Good evening, everybody. Professor Mani welcoming you on behalf of the Bombay Management Association. This is our 31st session in the series of the Wednesday Wisdom webinar, something which we started as early as April when lockdown was imminent. And we have taken our members through this learning journey over the last 30 weeks, every Wednesday with the Wednesday Wisdom webinar. We've had a series of speakers on various topics such as self-development, business strategies, artificial intelligence, even healthcare. And today, I think we are moving on to something which is so critical anytime, but more so in Corona times. And that is how to still keep the smile. Here we have today two very, very distinguished people from the field of dentistry. They have been serving the community over the last 60 years, if I combine their experience minimally. You see almost two generations of dental specialists here with us this evening. And I'd like to thank Dr. Kumarswamy and Dr. Nishigandha Bajaj for agreeing to be part of the BME event today evening. Let me give you a little idea about both of them. Very accomplished people in the field of dentistry. Dr. Nishi herself is a BDS and has about 20 years of experience in the field of dentistry. Her clinic is aptly named Smile Dental Care. And I think you can start realizing it when you meet up with her itself. And she's going to even spend time with us, guiding us today on how dental care could be the gateway to good health. She specializes in aesthetic dentistry, actively involved as part of Rotary and NGO movements, and serves the community. Of course, she's also an artist and a dancer. So maybe we should invite Nishi to be part of yet another program with BME to display another skill of hers. Thank you so much for joining us, Nishi, this evening. We look forward to a lot of learning from you. Introducing Dr. Kumarswamy is almost tantamount to introducing the Bhishma Pitamaha of the cosmetic dentistry industry or the dentistry field itself. Completes around 40 years of service to the profession and is a MDS as qualification. He, of course, specializes in aesthetic dentistry, cosmetic dentistry, and has often been regarded as who's who in the field of dentistry. Very active in the Indian Dental Association, International Dental Association. I still wonder how he found the time to even complete a master's in health and hospital administration as part of his knowledge acquiring journey. A person who loves to share, is part of several such international conferences. It's indeed our unique honor to have you with us, Dr. Kumarswamy, this evening. Thank you very much for being part of this BME event, and we look forward to a huge amount of learning from both of you. May I, at this point in time, welcome each one of you participants for this evening's learning session, and I request Dr. Nishi to take over.
Thank you so much, Professor Mani. A very pleasant good evening to all. Thank you, Professor Mani, for the lovely introduction and invite. I'm truly elated to be a part of this unique Wednesday Wisdom webinar concept. To start with, I would say COVID-19 has changed a lot of things. Most of us think that it has distanced us from people and our normal lifestyles. But I see this pandemic as an eye-opener that has taught us to value knowledge, people, life, and to be free-flowing in our exchange of knowledge and experiences with maximum number of people. So to share knowledge on the current advances in dentistry, it is my privilege and honor to have a discussion with the legendary and renowned Dr. Kumarswamy. I would say, as tooth is the only organ in the body which God gives us twice, yet it is the first organ that one loses quite commonly. And hence the need of a dentist arises to have a third set. So is this called evolution actually? No, I don't think so. But as someone has quoted that with evolution, things are always changing. So I sort of think, should we all be growing three heads? Mm, Jokes apart, the art and science of dentistry is an ever evolving process. So new trends, innovations, varied treatment options are being integrated in day-to-day clinical practice. So without further ado, let's start with the session. Over to you, Dr. Kumarswamy, sir.
Thank you, Nishi. Good evening, namaskar, sat sri akal, adab. It's such a wonderful feeling this early evening, if I may say, on a midweek slot, which normally we would be working from home, and we are working from home. If you look at the agenda drawn up by Professor Mani, it's a very unique agenda because in the middle of the week, early evening, to talk about teeth, probably you would say is out of place. But what is certainly in place is the intention and the desire to reach out to a large number of people who are wanting to know so much about their health, not only general health, but oral health. And if there is a connection, about the connection as well. What we're going to do is we're going to get into a tete-a-tete with Nishi, and I would start sharing the screen, and somewhere in between I'll stop sharing the screen and come back to a discussion. So please allow me to share the screen currently. So let me begin. Yes. So if you are talking about teeth and the advances that there are in dentistry today, what could they be? And we had used the word recent. The reason for that is most of you all, I'm sure, by now would have visited dentist at least once in your lifetime. If not, then it's time to do so. And the reason I say that is, gone are the days where we used to wait to be pushed through that dentist door, that dreaded dentist door, because of pain or discomfort, which is not allowing you to eat, chew, or smile or speak. We all know that children have milk teeth, while adults, we call it permanent teeth. Permanent because it's supposed to last a lifetime. If you take care of them, if supervised well by your dentist, if you go to them. A lot of ifs there. But let me add a but as well. If you think you're okay, you need to get that opinion endorsed by a dentist for sure. You may not have pain, but there could be some cavities which is not yet paining you. And we'll see as this presentation progresses as to how you probably will need somebody to tell you that you're okay. Rishi mentioned about all the organs in our body are only one and once in a lifetime, barring teeth. God has been kind. He gave one set of teeth while you were a child. And as you progressed towards adolescence, the milk teeth shed, 20 of them, and made place for 28. Yes, you must be wondering why aren't I saying 32? Because everybody will not have 32 teeth, a full complement of set. There are only a few who will have 32. So the 4 additional teeth, we call them as wisdom teeth, which normally erupts between 18 and 25. And at that late age, well, you can say early age, but late age for eruption of teeth, it occupies, or rather jostles for space and occupies whatever is given and remaining. That's where you will have a problem with the wisdom tooth. Realizing that you have discomfort and you reach out to the dentist and he says you need to get your wisdom tooth out. So that's as far as 28 and 32 for sake of count. We also today, as we'll discuss later in this presentation, have a third set. And the third set is called implant-based, implant-supported set. We'll talk about that. So when we're talking about what do dentists do to give you that perfect smile when teeth go bad. Okay, this is where we need to look at a few things which probably the dentist today has up his sleeve thanks to technology. So let me just now again bring in Nishi and see that where can we get, yeah.
Yes, sir. Thank you. In the olden times, rather a few years back, a visit to a dentist would always give creeps. But in this era of Google, Insta, Facebook, the patients have ample knowledge and courage to visit a dentist. Also, the awareness has been really profound. But to make them more adaptable and comfortable in the dental chair, what all newer techniques are introduced in dentistry, right from diagnosis to treatment planning? So, we would like to have your inputs on the same.
Okay, so Nishi mentioned about, okay, share. You talk about the newer advances in techniques and technology. And if you're looking at the technology part, we are now blessed with treatments which need radiology or x-rays. Gone are the days where we need to have a physical film. I'm not saying that it is completely done away with, but whenever you have newer technology, embracing it sooner would make it easier for everyone around. So we have digitized the mode of x-rays. The x-ray shooting machine remains the same. Probably it has come down in size as well. But we have a digital format of the x-ray, which helps us to zoom in and look at all those crevices, which earlier would not have been easy. The second part, and the most important part, is cataloging it or documenting it. Because earlier, either the dentist had your x-rays or you had the x-rays and you lost them. Because why would you keep an old record? But thankfully today, the dentist will have these stored digitally on their computers and can retrieve it as and when they want it. Also, thanks to the restriction of space, especially in a city like Mumbai, you don't need a separate area to develop the X-ray. And add to that the probable spillage and staining of the developer and the fixer. So we don't have all of these. We have a very convenient way of documenting, storing radiographs, what we call as X-rays. Also, what has happened now, it has opened up a new vista because X-rays are two-dimensional. There are times when we need to look at the depth and the third dimension. And that has been facilitated by CBCT. That means basically it's giving you slices of the jaw bones and the teeth. And also it tells you the exact dimension in all the three dimensions as to what is the area of intervention if required. This is called CBCT. So a dentist may recommend a CBCT. I'm not saying all patients will need it, but in those cases where the dentist need to look deeper, he may recommend a CBCT. These are available in special facilities, and the images are sent again through email or through a film, depending upon what the dentist has asked for. And the dentist then goes ahead and starts looking at the CBCT. The CBCT basically is the third dimension, which allows the dentist, like you see in this animation, which gives us that peek into the third dimension. Because there are times when we need to know where exactly is the cyst lying, or how bad is the infection, or how limited is the scope for treatment. All these things are facilitated by the CBCT. For example, the sinus or the proximity of the sinus to the tooth root, all of these are beautifully conveyed through a CBCT and through the third dimension. This brings us again, and I would like to again go off and bring in Nishi to see how we can discuss
Yeah, that was truly informative, sir. I'm sure the audience would be much more aware now. The apprehension and hesitation to visit a dentist would no longer be there. And now, sir, coming to the treatment modalities, what are your views on it, like on cavities and fillings and root canal treatment? Because we all know that the word drilling and filling itself is so dreadful and so fear filling. But are there treatment options better now? Can we have minimal visits for root canal treatment and the types of fillings?
So normally the word spine chilling is associated with dental drilling. That's how the patients view it. But let us make it easy for our viewers today to understand what exactly could be the problem with symptoms that they may come to us. So again, let me go back and continue from where I left off. So if you look at the image on the screen as it will appear, just to take you through the parts of the tooth. We all see the white portion as tooth, as you know, as tooth. That consists of an outer covering of an enamel, which is hard, which is really hard. The enamel covers a softer layer called dentine, which is basically a very sensitive layer. So whenever there is loss of enamel, the dentine conveys sensitivity, whether it will be temperature, like hot or cold, or sometimes sweet or sour, that transmits, the dentine transmits the sensitivity to the inner layer called pulp, which has got nerves and blood supply. So we have the kavach of enamel, and then we have the second coating of dentine, and the pulp, which is the softest and the weakest and the most important part, let's call it the heart of the tooth, is protected. We all know that if the heart is affected in a human being, and if it stops pumping, then you know what happens. It's the end. Here, fortunately, even if the pulp is infected and affected and is dead in a way, we do have another blood supply through the bone, which keeps the tooth alive. So actually speaking, it has got a dual blood supply. So just because the cavity which starts in the enamel goes through the dentine, hits the pulp at all the stages, the pain level can be different, can be tolerated or not tolerated, depending upon your tolerance threshold. So we call it sensitivity. The first thing is sensitivity. The moment there is sensitivity, you should know that the enamel has probably worn off or has gone atreated and it is exposed the dentine. That is when the sensitivity starts. However, if it's a more obvious cavity where food is getting stuck, that's time, whether it's sensitivity or food getting stuck, time to see your dentist. But what is the natural instinct? The natural instinct is when you have sensitivity, you probably will try to reduce the stimulus, which means once you identified that ice cream is hurting you, you probably will allow the ice cream temperature to become slightly warmer before consuming it. So what are you doing? You're basically masking a symptom rather than attending to it. So masking any symptom will definitely be hazardous in the long run. So at the earliest moment that you feel this teeth are sensitive, seek an opinion. Seek an opinion, and dentist at best will say, okay, apply something topically or locally, like a toothpaste, or he may apply some solution in the clinic and he may tide over that crisis. But if he finds the enamel is worn out, he may attend to it. He may give you a layer of what we call as a light cured composite filling or a glass ionomer filling. These are materials, newer materials, which is helping the dentist to treat these conditions. The tendency is to rush to the chemist and seek solutions. I would extend the extended family of the dentists to the chemist so that Together, we can address the situation rather than only going for over-the-counter products. Yes, you have various solutions, various products, but what is good for you, what is good for the condition, let the dentist decide. Then you had earlier what we called a silver amalgam fillings. That has given way today to tooth-colored material. So it could be composites, or it could be a crown or a cap which does not have metal. We call them metal-free looking tooth. Look, all the color can be matched, the shade can be matched, and it looks like a natural tooth. Whether you need a crown or whether you need a restoration, what we call as filling, let the dentist decide. And he will give you the best. Your dentist knows best. So please make sure. I'm not saying go to the dentist and get all your silver fillings replaced. But if there is some leakage, because they could be easily 20, 25 years old fillings, let him examine and he will advise you a tooth-colored restoration. This, to my mind, is very, very current, and also it's very aesthetic. So you do not have a metal shining through your smile. Let me now go to a situation called root canal. That is, if I go back and take you back to the picture of that tooth, where we had portions of the teeth. When we have a cavity, and the decay has reached the pulp, and the pulp has to be now cleaned up. This is a canal, the pulp canal. If that has to be cleaned up, it is called a root canal treatment. Now, let us get into a discussion with Nishi now and see how best we can address the root canal treatment. Yeah, Nishi.
Yeah, that was well explained, sir. Now, no more fears of drills and fills. And root canals can be completed with advanced technology in single sitting. Most of them, 95%, can be completed in single sittings. So there's a query, like, but most of the times it happens that the patient comes to us at an advanced stage when the tooth cannot be saved or it has already been lost or extracted. So don't you think that implants is the best option in such conditions?
Okay, good. So what we're going to do now is first tell you as to how earlier, if you had to have multiple sittings for a root canal, today's technology allows us to complete the entire root canal treatment in a single sitting. Yes, I repeat, you can avoid multiple sittings. Why am I using the word you may avoid? Because the dentist is the best person to decide. And the specialty related to root canal is called endodontist. So an endodontist, if you have been referred to by your dentist, for whatever reason that he felt best that the expert can handle your case supremely, the endodontist may decide to do and complete the root canal treatment in single sitting or multiple sittings. So there is no rule to suggest that all root canals have to be completed in a single sitting. But of course, today's technology has made it possible for this root canal to be completed in a single sitting. So when a root canal is completed, the tooth is salvaged or saved. This tooth, if we need to bring it back to function of chewing, needs a protection of a cap or a crown, as we call it. That cap can be designed by the dentist, fabricated by a laboratory partner, and cemented onto your tooth, which has received root canal treatment. There are very rare situations where the dentist may feel that a crown need not be done. He may just restore it and allow you marginal function of chewing. But most of the times you will need a crown or a cap. It protects the salvaged tooth and brings back all the functions of chewing. And Nishi mentioned about, in case you cannot save a tooth, most of the teeth can be saved with root canal, but in case you cannot salvage it, Then you will be advised extraction. And if you have lost a tooth, now what do we do in that space? We now have an option, what I originally in the beginning of my presentation mentioned as the third set given by the God. So you have an implant, which is a root substitute, which is placed in the bone. It may seem very painful. Believe me, it is not. The reason for that, bone has very minimal nerve supply. So when we drill the implant in the bone or place the implant in the bone, it integrates. It is made of titanium. It integrates with bone and allows the cap or the crown to be screwed in or cemented to the implant. You can either have a single tooth scenario, you can have a few teeth scenario missing, or you can have the entire arch or the entire mouth. This is called as full mouth rehabilitation with implant support. It is absolutely safe for all other aspects of the body. It also allows you to start chewing, speaking, and smiling. Basic tenets of expectation when you have teeth or treatment for teeth. This is called implantology. You also have the option of the white portion being in different materials. One of the most preferred material today is zirconia. So you may opt for a zirconia base, which is hard and allows you to eat and chew everything as your natural teeth. And you may ask me, what if the implant fails? Yes, there can be failures, but that's not the end of the road. A dentist would wait for that area to heal and will go ahead and place an implant again. And there are very, very few instances where an implant would keep failing again and again, unless there is something wrong with the general health of the patient. Then we talk about aspects related to teeth, where is there any alternative drilling? Yes, lasers have made a big impact in dental treatment today. So you can go ahead and use a laser. Now we would say that just a laser is a laser is a laser, but no, there are different types of lasers. The specific laser which will allow the dentist to go ahead and use it on the tooth to remove the decay, and minimally invasive penetration will allow the dentist to go ahead and do the restoration with a tooth colored material, what we call as composites. Or you can go ahead and prepare the tooth for a crown or a cap. This is as far as the laser on the tooth is concerned. What happens when your gums are infected? Would the laser help you into going ahead and treating the infected gums? Yes. In fact, laser treatment for gum infection is very common. You also can go ahead and use the laser in the root canal to disinfect the canal. Basic job of the laser is to disinfect and also to bring back healthy blood circulation in the gums. So you could have a non-cutting laser or you could have a cutting laser. Let the dentist decide what is optimal in your case. But we do have lasers. There's one caveat I would like to use here. If your dentist does not have a laser in his practice, it doesn't make him a lesser dentist. Why do I say this? I don't want dentists to feel that having a laser would make him a premium dentist. Nor would I want people to feel that if your dentist doesn't have it, he's a lesser dentist. So a laser is a good tool to have, but there's also a whole lot of treatment that you can do without the laser. So you can have a decay cleaned out by a laser, and you can have the gum infection also treated by the laser. Now let's again bring in Nishi and see, is there anything that we can talk about related to Smile?
Yes, sir. This was so well explained. You are a treasure trove of knowledge. I remember listening to your lecture during my graduation days, and I still today get to learn so much from you. You have covered almost everything.
Excellent.
Sir, there's a new trend in town of this getting beautiful smiles and getting things right with veneers and smile designing and teeth whitening. So we would like to know more about it from you.
Okay, so let's jump on to what we call as smile makeovers or smile designing. Now, what happens is patients, for some reason, are not happy with their smile. They chew well, they can eat well, they can grind well, but there's something about their teeth in display. We call that the smile window. So when a patient smiles, all the teeth which are visible become the smile window. Either if they're not happy with the shade of the teeth, or the shape of the teeth, or the position of the teeth, all of which makes them a little insecure and they hesitate to smile. Now, this has opened up a complete new vista as far as dentistry is concerned. I recall the times when a group of friends led by Dr. Sandesh Mayekar, whom we call very fondly as father of cosmetic dentistry, we started an academy called Indian Academy of Aesthetic and Cosmetic Dentistry in 1991. And our endeavor has been to educate our dental fraternity and the people at large that there's a whole lot of things possible to improve your smile. And we call that aesthetic and cosmetic dentistry. Your teeth, if the shade is not, you're not happy with it, we can go into teeth whitening called bleaching. Or if they're not okay as far as shape is concerned or position, we can have what's called as veneers. So you can see the before teeth whitening, after teeth whitening. There are various methods. You can either get teeth whitening done on the dental chair, followed by some advice that you can follow at home, or you can have just home bleach. Obviously, home bleach will take longer. A chair-side bleach or a walk-in bleach in the clinic will be faster. Is this everlasting? Friends, nothing is. So even this, depending upon your lifestyle, if you're more into, if you're a coffee or a tea drinker, or if you're a red wine drinker, basically what teeth whitening or bleaching does, it takes away the impurities from the teeth and makes it lighter. But if you're going to jump back to your routine and indisciplined lifestyle, your teeth are going to come back to its original shade. So this, we may call it short term. I don't call it temporary, short term. Because the short term, in my definition, your definition can differ, but it is short term. This is called teeth whitening or bleaching. Then we have what's called as veneers. We all are familiar with our furniture at home. We have a table made of wood, and to make it aesthetic, the carpenter would bond a thin layer of what we used to call as mica earlier, or today we call them veneering material. Similarly, we have a veneer made of ceramic or composite, which is bonded, like you see in this picture. You have teeth which were decayed, teeth which were dark in shade, and the veneer has been bonded. That brings back the smile. And if at all you're wondering, how come all the heroes and heroines of Bollywood and Hollywood, more of Hollywood, less of Bollywood, have that ideal smile? It's because most of them have got these veneers bonded onto their teeth to bring the smile. Of course, there's a lot more than just bonding, but just to make you aware that this is one of the possibilities. And you also have almost what is called as no prep laminates or veneers. They're so thin that without taking away much of your teeth surface, because if you take away a lot, your teeth could get sensitive. So we have these veneers. So we preserve a lot of your tooth structure and we bring about a uniformity in your smile. That brings us to another option in orthodontics. We all have been used to these braces in orthodontics. Orthodontics deals with the field of straightening teeth, malaligned or malpositioned teeth. But today, there's something called as aligners. Aligners is a set of trays. It's made of hard plastic. So a patient just wears those trays, a series of trays over a period of a year or year and a half, and the teeth get straightened. So there is no need. Again, the dentist and orthodontist would decide for you to go in for metal braces. Of course, there will be a difference in costing, but patients sometimes prefer that wearing a translucent or transparent tray, they can go about their normal chores. Then of course, aligners is an option for you. So here is the way in which an aligner can be worn by the patient. That's how it goes into place. You can go about doing your normal stuff of speaking, eating, clean it well, of course, because the results are stunning. You have the befores where the teeth were malaligned and they could be well aligned in the space of what, like I mentioned, a year or a year and a half. The flip side of it is, if one is irregular in wearing it, it may take longer and it becomes costlier because the longer it runs, you need more sets of trays, and that's what happens. Yeah, Nishi, I think aesthetic dentistry there opened up new vistas.
That was very well explained, sir. Since we are talking on advances in dentistry, don't you think that the way we all are practicing in today's COVID times is itself an advancement?
You know, I'm glad you mentioned this because otherwise I don't want viewers to leave us with all great feeling, with a small doubt in their minds, saying that, well, in COVID times, we heard that dentists are high risk. So what are the precautions that we are taking to make sure that they are safe? So let me just add a few points here to improve your confidence levels and instill that feeling that all is well in dental clinics. So what has changed? First of all, please shed the fear. As we speak today, there's not a single case reported where dental clinic is a super spreader of the dreaded COVID infection. Still, dentists take great precaution and we expect a lot of cooperation from your side. Like for example, if you were to look at dental clinics where wearing a PPE suit, okay, to make sure that not only the patient, but even we are at high risk. So we ensure that our staff, our clinic operatory, our instruments, we have stepped up the care of sanitization and sterilization. Like for example, the UV tower. The UV tower, the ultraviolet tower, between two patients will take care of all the viruses and the fungi in the room. So we allow a cycle of around 7 minutes to 10 minutes. Nobody is supposed to be in that room. So if at all your dentist is delayed in seeing you, please understand that it's in your interest that he's introducing this protocol of making sure that the chair in the clinic is safe for you to sit and undergo treatment. Also, what has happened now is dental disease, the oral health is strongly connected to general health. So if you look at this picture, earlier we used to say that if you are healthy in the mouth, you could be healthy in the body. But it was just casual. But today it's more causal. And why do I say that? Because there is evidence to suggest. So your gum disease and your whole body health is very strongly connected. And we'll see how one by one. Osteoporosis. People who have gum disease are at a higher risk for osteoporosis. Stroke. And by the way, I'm not being a casual say, each one of this has got evidence in scientific literature. People with severe gum disease have 3 to 4 times the higher risk of a brain stroke. Alzheimer's. Gum disease is linked to Alzheimer's, and the oral bacteria is also identified in the bloodstream in these patients. Cancer may sound very scary, but it's true. Several studies show strong evidence linking gum disease to pancreatic cancer and oral cancer. Respiratory disease, especially in the days of COVID pneumonia, the least you can do is to at least take care of the gums, because we don't know whether you will get COVID or you don't. We don't desire you get COVID, but at least let's get one risk factor out of the way by ensuring that your gums are healthy. Heart disease. There's something called a CRP, C-reactive proteins. If you go for a blood test today for COVID reasons, there'll be a parameter CRP. It is noted that in gum disease, the CRP is elevated in people, and also in people who have heart disease, the CRP is elevated. So here is the link. So we want to make sure at least one of these is taken care of. We won't wait for the heart attack to happen. At least we'll make sure that your gums are healthy. Now, this is a two-way street, diabetes and gum disease. If you have gum disease, you could be at a higher risk for diabetes. So your dentist will be the first person to identify and advise your physician to please keep checking for blood sugar levels before you get labeled as a diabetic. If you are a diabetic and if you have gone to your physician, a request to the physician and shout out to all of them is that please refer the diabetic patient to the dentist so he can then identify and take care so that he does not go ahead with advanced gum disease, because a diabetic patient may get gum disease at some point in time, and it allows the dentist to step in. Rheumatoid arthritis, again very common. These patients are 8 times more likely to have gum disease. So if you have or you're undergoing treatment for arthritis, make sure you visit your dentist to at least stay away from advanced gum disease, what we call as periodontal disease. The expert who would treat your gum disease is a periodontist. And I would like to end up with these 2 slides to mention that in men, the gum disease is higher, it's kinder in women, and especially if a woman is pregnant or even before she plans a child, my advice is just get to a dentist to check whether your gums are healthy, because gum disease during pregnancy is known to trigger preterm low birth weight babies. So this is the correlation that we have. That's why we call it gateway to general health. That is where I would like to sum up this particular discussion and take questions. Thank you very much for this brief presentation. Thank you, Nishi. You were wonderful into nudging me at the right spots. I will stop share now and get into a discussion.
Thank you so much, sir.
Thank you so much, Dr. Kumarswamy and Dr. Nishi. I think the manner in which you were able to move from the presentation to the discussion almost made it a jugalbandi and made it very, very interactive with the audience, because many questions you raised were actually very, very fundamental and yet at the top of the mind of so many of our participants. I have some questions in the chat box, which I'll be happy to share with you, and I'd request your response on the same so that we can continue to discuss with our participants for the remaining couple of minutes. In the meantime, others who have questions can put them in the chat box so that I can bring it to the notice of the esteemed 2 doctors in our panel this evening. I'd also like to place on record the support of GSK in making this program happen. And most of us, I guess, are aware that today, besides the routine cosmetic use of a toothpaste, sometimes even the toothpaste may double up to be a good medicine, like an OTC product that many of us are used to. And Sensodyne is one name that many of us already are aware of. One of the first questions that's come, Dr. Kumar, is, are there certain foods which are inhibiting in general, as they do end up decaying teeth over a period of time? Because I think बचपन में सभी लोगों ने सुना होगा कि चॉकलेट खाने से दांत खराब हो जाते हैं. I guess the question stems from there. So let's have a word of wisdom from you.
Let me blow the myth. And the myth here is, अब आप ही सोचिए, बच्चे चॉकलेट नहीं खाएंगे तो कौन खाएगा? However, there's a disclaimer to it. Disclaimer is, please make sure your kids have the chocolates only at meal times. That is, and I was very happy with my kids where I tried out this experiment about 30 years ago. Tell them this chocolate is for you. You can have it on the dining table, either with breakfast or with lunch or with dinner, not necessarily with at all 3 times. But what happens is, at least from the dining table, they will walk to the sink and rinse their mouth. What is dangerous is the stickiness of the chocolate. Snacking between meals, it adheres to the enamel, especially to the child teeth or deciduous teeth, milk teeth, and start the decay, or young permanent teeth. Because young permanent teeth are still not very defensive, wherein the enamel is strong to resist the acid attack. So that's as far as the chocolates are concerned. There's a different threshold from person to person of decay tolerance, means the acid attack by these bacteria may affect different people to different levels. So you will have someone who is snacking away on chocolates without decay, and you have somebody with minimal. He's taken all the care and he still ends up with decay. So there is no rule to suggest that you will always have decay if you eat sweets. You may have it even otherwise. However, minimizing it and with discipline, in moderation, that's the key as far as sweets and chocolates are concerned.
I guess that's wonderful news for a lot of people, including me. All right. The next interesting question is, what is your opinion on the use of mouthwashes? How effective
Okay.
or how
So
avoidable?
let's understand, a mouthwash is not a mouth freshener. Most of the people use mouthwash as mouth freshener. A mouthwash, we call it mouth rinse, is made of a chemical with a particular agenda and use and application. And the idea is to attack the plaque or the biofilm. And we talk about plaque as that layer on the teeth, which is greasy and which gets accumulated and it's got a lot of collection of the bacteria. Now, if you want to dismantle the colonies of bacteria, your brushing, if it's inadequate, and we all know the reach of the brush is limited. So to improve and increase the reach, we use a chemical like a liquid, like a mouthwash. And this reaches into all the crevices and ensures and battles with the bacteria and nullifies the ill effect of the bacteria. That's where a mouthwash is used. Should everybody use it? No. Who should use it? Again, get to your dentist and he will advise whether you need a mouthwash. A mouthwash are different kinds. Either it could be ensuring what we call as anti-plaque mouth rinse, or it could be for sensitivity. So depending upon the need and the requirement, your dentist will advise you on the need of a mouthwash.
All right, noted. What are your tips and advice to ensure healthy gums in as natural a manner as possible?
Ideally, gums are pink. The moment in a mirror, and please spend a moment or two, and yes, I want you to be vain and spend some time in front of the mirror, admiring your gums in a day whenever it suits you. Why? The moment you see the pink turning to red, that's the time when you need to see a dentist. So if you feel that it's turning red, or if it is puffy, or if it is bleeding unprovoked, or if your spouse or your best friend is suggesting that you have a foul odor, or if you feel that your teeth which were firm are suddenly feeling a bit mobile, these are all signs of gum disease. And you can have the gum disease as a marker for, like I just mentioned, for a diabetes or a heart problem thing to set in. So use this gum disease, use the status of your examination, both yourself and the dentist, to come to a diagnosis, get into a treatment planning, get them cleaned regularly. Regular cleaning of teeth does not harm your teeth. I want to blow that myth that मेरे दांत मजबूत थे, dentist ने हिला दिया. ये कभी नहीं होता, ये कभी नहीं होगा. So don't worry, get them cleaned regularly so that your gums will remain clean and healthy. And that alone will ensure a lot of general health for you.
Okay. Specific question. How does one deal with acute gag reflex?
So that is a dentist's problem, not a patient's problem. However, if one is gagging, the first thing at home you need to do is please use a non-foaming toothpaste, because it's the foaming toothpaste which stimulates gagging. That's as far as your home care is concerned. As far as in the clinic is concerned, we have various means to tackle a gagging patient, especially when we need to make an impression. The patient may gag, but there are various techniques. There are some medications we'll advise that you take at home before going to the clinic. That will help you to overcome a gagging reflex. A gagging reflex is when you sort of feel like throwing up, because somebody has put something in your mouth and you feel like throwing up. So a gagging is a normal reflex, but in true patient, it's exaggerated, and that can be taken care of at home by using a non-foaming toothpaste, and in the clinic by the dentist.
Okay. Does oil pulling help oral care?
So oil pulling is one of the methods, especially by what we call as allied stream, the mainstream and the allied stream. And there is a lot of studies to suggest that when you take oil and move it around in the mouth, we all know that it's a good disinfectant. So that takes care and makes the gum healthier and improves the blood supply marginally. So I'm not saying it's the end all, but it's one of the options of ensuring healthy gums, especially if you don't want to apply a chemical by way of any ointment or an application of a gel or a mouthwash, and what we call as non-medicated. Yeah, oil pulling does help.
You did mention, doctor, about the braces and so on to make the teeth look more beautiful. How does one distinguish between the use of braces as a necessity vis-a-vis for, let's say, the style and the fashion statement?
Nishi, you would like to throw in some points there before I answer that? Because why I'm asking Nishi is the younger generation has got a different set of mind and thinking. That's why I want to bring in Nishi. You can unmute yourself, Nishi, and just let them know. So currently, what are the patients coming to you related to the brace? Yeah.
So ideally, braces. I think from an aesthetic point of view, youngsters are definitely going for that. But in my personal opinion, unless it is recommended by the dentist, one shouldn't go for it. So it always needs to be done under proper guidance by the dentist, because it is a long-term process. It's a long-term treatment, maybe 1 year, 1.5 year, 2 years. So just for the sake of aesthetic value, one shouldn't go for it. The dentist is the best judge to prescribe you whether you need braces or not.
In lighter vein, I may add, a patient came in asking for braces. When I say patient, a young boy, parents brought him in. So I asked him as to why would you want braces? Because his teeth seemed to be all right. He said, in my class, there was this boy who was not doing as well. From the time that he got his braces, he started doing well. So even I want to sort of beat him at that. So a child's mind works differently. And then we said that, no, beta, you don't need it and you will do well even otherwise. So there are a lot of things working in a child's mind. So we as professionals advise only if needed, like rightly put by Nishi, that we'll examine and if the function is compromised or whatever. However, beyond this, the parents allow the child to become an adolescent and he then has a mind of his own and he says, I want to now smile better. You have the field of aesthetic and cosmetic dentistry to take you further.
Sure. A very fundamental question. How many times in a day should one brush one's teeth?
So ideally twice, assuming that it's a 7 to 10 hour cycle break. Why do I say this? If you move your tongue over your teeth, there'll be a coating, what we call as biofilm. It takes around 7 to 10 hours for the biofilm to mature with bacteria, where the ill effects of the biofilm and the bacteria start acting. So to break this cycle, if you brush, then it will again take a further 7 to 10 hours. However, the night time, assuming that you sleep for 7 to 8 hours, that's in the morning. First thing is you'll break that cycle. And again, you will brush after another 10 hours or 12 hours, which will be before you go to sleep. So this is how we recommend at least twice. Yes, if you want to brush more time, be our guest. There's no harm. It can't do any harm. However, be gentle, be kind to yourself. If you have foul odor, multiple number of times of brushing is not going to, you're only masking it. Just get to a dentist to find out why there is a foul odor.
So Kumar, what you're saying is the more the number of times you brush, the companies who manufacture toothpaste would benefit more than you.
I'm not saying it.
All right.
We would never say it.
Yes, that's, that's exactly what you rightly said, that there is an optimum number for everything.
Yes.
One just can't be carried away by things like that little boy story whom you actually mentioned. Another fundamental question, toothpaste or toothpaste, which is better?
Sorry, I lost you there. You're frozen.
Okay, I'll repeat, toothpaste or toothpaste, which is a better option?
No, I didn't get you again. Hello?
Yeah, I'm with you. Are you able to hear me?
Yeah, your voice is a bit stuttering. What would you say?
Okay. Toothpaste or tooth powder, which is a better option?
Okay. So if you look at the consistency of a tooth powder, now we know that a tooth powder is gritty in consistency. So when one uses a tooth powder, you may be doing harm to the tooth surface. And repeated use of a tooth powder, you will wear off the enamel. And I mentioned before, enamel is the strongest. And if you keep wearing it off, the dentine which it exposes will be softer, and that will be causing more damage. A toothpaste certainly is recommended. However, I recall the times after entering dental college, the first challenge I had was to change my mother's usage of tooth powder to a toothpaste and toothbrush, which took a long time because you're habituated and it's difficult to break an old habit. But if one uses toothpaste properly with a toothbrush, which has been again optimal for your teeth, all of you all need not use a hard toothbrush. All of you all need not use a soft toothbrush, depending upon what is the status of your gums and teeth, as advised by your dentist. Unmute yourself, Professor. Yeah.
The next question pertains to the use of a tongue cleaner. Is it advisable or not?
So tongue brushing is what I would recommend rather than tongue scraping. The reason for that is our taste buds on the tongue are very essential. When you keep scraping your tongue with a scraper, you're harming the buds, taste buds. And we call them as papillae. Whereas if you brush the tongue, especially as much back as you can go without gagging, you're disturbing the what we call as odorogenic bacteria, means bacteria which causes foul odor. So it's important that you take a baby brush, a small baby brush, go as much back as you can on your tongue, dip that brush if you want to in betadine, and disturb the colony of these bacteria. Once you disturb the colony, the foul odor will be at rest. So this is what we advise of tongue brushing rather than tongue scraping.
Related question is, what is your view on flossing?
Okay, now the flossing being very good, it's also difficult. There is a user curve which is extremely difficult. So nowadays we have floss holders. If you go to a dentist, he'll give you a floss holder, and then you can pass the floss to the floss holder and floss. What is the floss? It's like a thin thread which goes between the tight contacts of your teeth, allowing you to clean it. As a substitute to floss, we today have a motorized toothbrush. We also have what's called as interdental toothbrush, a small, like a bottle brush. So you can use these instead of flossing. However, if you can floss well, very good for you. Don't be harsh on the gums when you're flossing, because it may tend to disturb and distort your triangular part of the gum between two teeth. So be gentle as far as flossing is concerned.
A majority of India is still living in villages and use products like the datun, which is the good old toothbrush cum toothpaste. What is your view?
So when we talk about datun, what is good about the datun is when you chew it and the bristles, when you chew the liquid which is squeezed out is good for your gums. So use that to massage your gums. And the free end or the bristles of that datun, be gentle on your teeth. If you're so used to using the datun. However, if you can wean away from datun, and get to a toothbrush, it will be helpful. But if anybody were to say Datun is harmful, I wouldn't agree. If used the right, because they've been used for centuries. Come on. Today we can't say it and write off a Datun. As long as they are not overdoing the chewing part and overdoing the brushing part on the teeth with the rough edges of the Datun.
Okay, so we have with us one of our senior members of the Bombay Management Association, a past president, Mr. Ernest Fernandez. Mr. Fernandez, over to you. I've unmuted you.
No,
You have to unmute yourself.
Today we have moved doctor from the mental to the dental. Doctor, wonderful talk. I have a very comfortable denture, which I've had for a couple of years. It's my mainstay. Now it's showing signs of wear. If I take the denture and I give it to my dentist, will they be able to make an exactly duplicate denture?
Wonderful question. And I'll tell you why it's not happening. Over a period of time, your dentures in usage, there's a wear. There's a wear on the teeth of the denture, number one. Number two, your denture is seated on your gums, on bone, underlying bone. So even the bone undergoes changes, which means if you take two fixed points, one on the tip of the nose and one on the chin, as my distance, we call this the vertical distance. Over a period of time, the vertical distance has collapsed. Okay, so if it's collapsed, if I were to make a denture exactly what you're going to give me, I'm going to give you a denture with a collapsed bite. That's why you would notice some people with an oval facial structure, as they age, there's a sort of a collapse. That's the reason why we need to re-establish the vertical. So a new set of dentures is the order of the day.
Thank you. Thank you.
Yeah, we also have with us Inderpal Singh. He's again a past president and a very senior member of BMA. Over to you, Inderpal ji.
Yeah, Dr. Kumarswamy, the wonderful advice and wonderful presentation. So thank you so much for taking time for us. I think you have covered most of the anxieties that people in our age group have. I would wonder, I don't know where exactly in Bombay you practice, but I would certainly, one who would like to come and show my teeth to you and have them examined annually, because most of the dentists that I go to probably don't bring up the issues that you have raised. So I think that's wonderful. But many years ago, I had my first root canal at the age of about 23, 24. And one doctor in Calcutta had advised me that if you want your teeth to last up to 80 years, you keep brushing twice a day, as you said. And the second one was tie a piece of towel around your finger, index finger, and massage your gums twice a day. So this advice, though, I have followed on and off, so my teeth are not so bad. But I think it's a good way to massage the teeth. I don't know whether today's time such basic advice would hold valid or not. But what else we can do to extend the life of our teeth, say, to 80 years and beyond?
Okay, teeth lasting in the mouth for long enough is certainly genetic, or what we call the hereditary. There's a very strong factor, abetted by the care that the person has taken right through adolescence and through a young adult and growing years of 40, 45, 60, 65, 70 and thereon. However, like you mentioned, if one can use the finger after you set aside your brush in the morning, use the finger and use the same toothpaste and massage your gums. Now the direction of massage is important. Why? The blood flow in the lower is in this manner. The blood flow in the upper is in this manner. So you have to allow the river to flow in that flow. So similarly, if you massage your gums from down upwards in the lower gums and up downwards in the upper gums, you would be assisting. You'll be assisting the blood supply and keeping the gums healthy. You may do everything, all of these what I have explained, but still please visit a dentist regularly to make sure that all is in place, and if there's any slip up, he gets an opportunity to catch it at an early stage.
Wonderful. Thank you so much, Kumar, and thank you once again, Dr. Kumarswamy and Dr. Nishi. As they often say, all good things do come to a pause, because in today's internet world, when so many of us can be connected, as Nishi rightly said, the lockdown taught us how to connect despite being physically away, but we could still connect digitally. And some of you have asked in the chat box how you could reach Dr. Kumarswamy. I have put down Dr. Kumarswamy's website in the chat box. So that could be perhaps the easiest way to reach him. Of course, if you Google for Dr. A. Kumarswamy, I can assure you, you'll find pages and pages of work that he has done over the last 4 decades in building up this profession, from being a dentist to getting into more advanced areas like cosmetic dentistry and the latest techniques that he shared with us. Thank you, Nishi, for ably leading this session and making it so interactive. And it made a huge impact on every one of us present here. As we always do, may I request everyone to put on their cameras and flash on their best smiles for a photograph that we shall take. This is not specially for today, Kumar. We do it every time. And we'll be happy to share this picture with you as a memory of the times that we spent together learning from you this evening. So please give us about 2 minutes. We are in 3 screens.
Yeah, in the meantime, please allow me to thank all of you. It was a wonderful session for us. And of course, to a special word of thanks to Nishi and her better half, Ajay Bajaj, who has been such a dear friend over the years and who has enabled this session. And Nishi, welcome to the world of presentations. And we're going to see more and more of your presentation.
So much from you. And indeed, it was a very great learning experience for me too. Thank you, Professor Mani. Thank you, everyone. Thank you, Dr. Kumarswamy, sir. It was amazing.
Most welcome. And everyone, please put on your cameras. There are still some of you without cameras. You'll end up only having your names. While you get ready, if you need to, for this group photograph, may I tell you that next Wednesday, we have a very unique session. Today, Kumar and Nishi taught us about the importance of smiling and how you could smile better if you had a good set of teeth, either naturally, genetically, or with the help of a dentist. The session next week focuses on happiness quotient, and we thought that would be an ideal thing to do on the eve of Diwali. So 11th November, a very special session coming up by Suresh Srinivasan, a well-known international trainer on the topic happiness quotient. I hope you'll block your diaries and be here with us for the next Wednesday webinar. May I also add on that the next 3 days, BMA is organizing a digital leadership summit where we are looking at the impact of digital on the entire gamut of business and industry. I'm sure you've seen the details on the website or our mailers. You can still register and get more details from the website. Give us that little bit of digital patience, as we always say. Our team from the Secretariat, Lakshmi, Oindrilla, Supriya, will grab your smiles. Just give us 2-3 minutes to complete the group photograph.
Done. Thank you, everyone.
Thank you, everyone. Have a good evening and look forward to our continued interaction in this learning series. Thank you, Dr. Kumarswamy, and thank you, Dr. Nishi Bajaj. See you all next week.
Thank you. Bye-bye.